A worsening baby formula shortage is forcing some parents to take drastic measures that health experts warn could be harmful to babies. And in response to the shortage, many major retailers have instituted purchase limits. CBS 58's Adam Rife is live in the newsroom to explain what can be done. Adam.
Well, Natalie, some parents are trying to stretch their formula by mixing it with more water. Others are trying to make their own formula at home, both of which could be very dangerous. And people who are trying to help by buying formula to donate may in fact be making the problem worse.
I'm hearing moms just expressing panic. I don't know what I'm going to do. I've only got a week's supply of formula left. I've been to every store in my area.
That mom lived in New Jersey, but called Sherry Tussler at Milwaukee's Hunger Task Force because she was that desperate for formula. Sherry connected her to resources in her area. Tussler had 20 pallets of formula a few weeks ago. Now she's down to 1.
And I come and look in here, and I see if I can find a can or two, because a can or two maybe will get them through that crisis moment.
The latest data shows 40% of baby formula is out of stock nationwide. Some national chains have instituted purchase limits to try and keep supply on the shelves. And some parents are trying to stretch what they have, but formulas are made with very specific combinations of calories, fat, protein, carbohydrates, vitamins, and minerals.
So if this is diluted with water, this can actually be really dangerous to an infant.
Store-bought formula goes through a rigorous process in order to get FDA approval.
So homemade formulas can be quite dangerous and have resulted in hospitalizations for patients that I've seen in the past.
This formula shortage has forced many women to rethink how they're feeding their babies.
We have noticed a number of women who are contacting our office to ask for additional support to actually relactate their baby.
The Hunger Task Force has an interactive map to find locations that have formula. Plus,
the Women, Infants, and Children's program has also always been a supplier of formula, and they may have some. They may have your brand.
Now, Sherry Tussler at the Hunger Task Force says anyone with surplus formula can drive right up and drop it off. But if you're out shopping and you see formula on the shelves, she says do not buy it to donate, even if you're trying to help. She says leave it there so parents who are looking for it there will find it. In the newsroom, Adam Rife, CBS 58 News.
Really good information.